Good afternoon. I'm Brielle Batchelor, and this is my weekly health segment. And on today's episode, I'm going to be discussing drug abuse and prevention. And today, I have a specialist from the University of Georgia here to kind of confirm and clarify everything individuals might need to know about drug abuse and prevention. So, if you just like to go ahead and introduce yourself, again, I have Dr. Jordan Khail here from the University of Georgia.
Absolutely. I teach at the College of Pharmacy at UGA, and among other things, I also have a grant with the Georgia Opioid Crisis Abatement Trust, where we use pharmacies all over rural Georgia to help educate and provide their residents and communities with naloxone, which can be life-saving in an overdose from opioids.
Thank you so much for that introduction. And then just to go over again what we'll be touching today. So, we'll be discussing prevention in teens, college students, and adults. We'll also be going over common myths about addiction and recovery, early warning signs of misuse, and then whether or not mental health plays a role in the substance abuse, and then lastly, prevention programs. So, the first question I'd like to ask you is what are some trends that you might be seeing right now in substance abuse and overdose risk in Georgia? And what drugs are people tending or looking to abuse at this time?
So the current trend has actually held for quite a while now, for at least 5 years and actually a little bit longer, and that is illicit fentanyl. It has replaced kind of taken over. As a result, it is the number one cause of death in people 18 to 45 in the entire country. And it while there are smaller changes that have happened since the fentanyl crisis began, it's still the same issue that we're dealing with. It is impacting those that are very young in some cases, and really every age range, and people come in contact it for reasons. But it is a huge health risk. So it can be those that are recreational using, but it can also, people can get a hold of a tablet that they think is something else, and it ends up being a counterfeit tablet mixed with fentanyl. So it is a very sad story and is very, very dangerous and killing a lot of people.
Exactly. And it's important to note that individuals might come across these substances or tablets and they be completely different than what they thought it would be. So that's why it's important to just stay away from these altogether. And so, just getting into my next question, when it comes to prevention, what actually works best at each level? And when I say each level, I mean for teens, college students, and also adults. How do you think prevention should go for all of those groups?
The most important thing we can do, and maybe I'm biased as an educator, but it is the education piece. If people don't understand the risks, then they can't really try to meet where that risk is at. So we have to acknowledge that the risk is in every community. We have to really understand what that risk looks like, and that's how we can help educate our community members about those risks and how to avoid them as much as possible. The way that risk comes about differs in age groups. When I'm talking about, a high school age or college age individual, we're probably talking about potential experimentation or recreational use. As we get into, the college to middle age, we're thinking more about, longer term addictions that have their own concerns and process forward. And then some of our older adults, it's not necessarily illicit fentanyl, but sometimes they're prescribed opioids that cause the biggest risk for them. Because it's very easy to end up accidentally overdosing with a combination of drugs or mixing alcohol with them. So we see people overdosing in a bunch of different ways, and that education piece really has to be kind of targeted to the group that you're speaking to.
And when it comes to families being involved with prevention and, being supportive of family members who are abusing those drugs, are there any myths when it comes to being involved in that recovery process that you wish you could correct when it comes to families being involved?
I think one of the biggest gaps in understanding is just that addiction is completely treatable, and it's also not necessarily connected to any fault of that person. We know that there's predispositions towards addictions. We don't understand them fully, but we understand that some people have certain genetic makeup that will make them at higher risk, and there's also all of those other social determinants, like trauma or dealing with a loved one or a parent that suffered from addiction as well, that can increase their own risk. So the biggest thing to understand, I think, is just when we come across somebody who has fallen into addiction, is to get past the blame and move on towards the treatment and solution. It is treatable. It takes time, and it's not always a smooth process, but these people can be helped. They can get back to normal life, and be completely healed from this.
And for parents and caregivers involved in this process with helping those loved ones along, what are some early warning signs of misuse, and how should the first conversation go so it doesn't feel as though they're bashing their loved ones?
The early signs are kind of difficult, especially if you're talking about somebody who's a teenager. Some of those just look like regular teenage behavior in some cases. It can be mood swings. It might be, a loss of interest in some of their hobbies or existing relationships. I think, nobody knows their children better than the parents themselves. And what you're looking for is a general change in their overall behavior that seems out of character. And the earlier you're able to have that conversation, the better. And my belief is that this needs to be tied in with these early conversations we have about underage alcohol use and any sort of substance use. Now we just have this new piece to the conversation, being these fentanyl opioids, that are much more powerful than anything that existed before.
Exactly. And I like that you bring up that mental aspect of it and just paying attention to your children's behavior, right? Like you said, your family knows you best in most cases and they're around you. So just paying attention to those behaviors is so important. And then when it comes to anxiety, depression, trauma, and, ADHD, how do you think those all correlate or relate to the substance abuse aspect of it?
So there's a lot of studies that tie those first three, being depression, trauma, and anxiety, and there's overlap between those three as well. But there is definitely a connection in risk for potential addiction or overdose risk in the future. That has been well studied, and that having one, can certainly put you at higher risk, to falling into addiction with opioids or any of the other substances. With ADHD, I think it's still early to make a determination. There's studies that show a connection, but there's other studies that show that if someone has well treated ADHD, that their overdose risk actually goes down. So it is important to understand that mental health always plays a role in this, and addiction is a mental health disorder. And sometimes we have comorbidities. A lot of times we will be sick with many things at once, and that can make treatment a little bit more complex, and it can make some things more likely to happen. But we have effective treatments for all of these things. It's just about finding the right care.
Exactly. I think that's so important. Finding out the right care, finding out what works, will truly be helpful in the long run. And so, just to close out our conversation, if someone is ready for help today, what's the simplest next step you recommend, and what resources should they be asking for?
So, the next step will differ depending on where they're at. Sometimes it really can be just as simple as finding a local support group, like a narcotics or alcohol anonymous group, where you can find a community of people, that can support you and have been through it themselves. In more severe cases, they might need to be hospitalized, and undergo detoxification treatment. However, at the end of the day, if you really are kind of at an end where you don't know what the next step to do, the best thing you can do is just call 988. It is basically your 911 for this type of crisis. Even if you're not in a full crisis, they can still help you find local resources and access, and affordable access. So they're an amazing resource, and they have a response team that can show up if they need to, but they will always help you find what that next step is. And it's three numbers away. 988.
That's so important that you mentioned calling that number. I'm sure in many schools they have these drug prevention and drug abuse programs, but just being able to simply, call this number is super important for individuals who might not be open to speaking to loved ones or counselors at school. So I do appreciate you mentioning that.
Absolutely, and they are trained to handle all manner of issues, and they do a great job.
Well, thank you so much for coming on to chat about drug abuse and prevention, and I'm sure our viewers will find all of this information helpful.
Absolutely, thank you for having me.
Thank you. Have a good one.